Hi, in this video we'd like to go in detail on the types of HG vaccines that we offer in Antai Hospital for our hyperemesis patients. So Antai Hospital offers HG vaccine, which is our proprietary treatment that can effectively treat and allow you to recover fully from Hyperemesis gravidarum. In our hospital, there are two types of this HG vaccine. The most common one, which is the first type, is an injectable form where we administer it via intravenous, intramuscular injections, very similar to how insulin is administered. That is option one. And option two is an oral medication where you can just directly consume it and then you can see the effect of the treatment. These two medications, treatment modes, they have similar compositions and also they work in a similar way. The mechanism is exactly identical. However, because there's two categories, we need to use them according to the patient's individual case, how severe it is, and also existence of pre-existing conditions and complications. Now we call this treatment HG vaccine because of how easy it is to explain to our patients. Many of our patients also refer it as a HG vaccine, but in fact it's not really a vaccine, it is a HCG desensitizer. That's the medical term that we refer to the treatment of Hyperemesis gravidarum. And how it works is that once it is injected or you consume it, the sole purpose is that it needs to block the H2 receptors, these abnormal receptors that are abundant in hyperemesis patients, which is abnormal, and they are situated in your nervous system, places where it regulates sleep, vomiting, nausea, and other functions, for example, gland secretion, digestion, so on and so forth. They have high levels of H2 receptors, so this treatment will serve to block these H2 receptors so that the real, actual HCG cannot bind and the reaction ceases. That is why our treatment is so effective. Many of our patients with the first injection alone, they can see immediate relief and recovery upon the next day. After the sleep that they go into, you will see symptoms subside very quickly because of this concept. When patient comes to hospital, Antai Hospital, first of all, we will usually give you one shot of this HCG desensitizer, this HG vaccine via injections. Usually these types of patients are quite severe form of Hyperemesis gravidarum. They're constantly vomiting and they've already severely malnourished. They're in a critical state. So this first injection is to allow her to quickly stabilize. Many of them already see that the symptoms slowly disappear. This is to secure the mother's life and then also the life of the pregnancy as well. And after that, once she's stabilized, once the symptoms have either significantly reduced or ceased, then we will give you the oral medication as a form of supplementary treatment to support her condition. Then she no longer needs injections anymore and she can take the oral medication. However, we do have a principle that we follow here at Antai Hospital, is that those who can take the oral medication usually do not need the injections. So these types of patients are usually less severe. Those that can still put down some form of medication, they can still eat, they can still drink. These types of patients, we don't really need them to go for the injection. Just the oral medication will do. However, we do need to observe the outcome as well. Some patients may need injections, but generally, if those who can take oral medication, if they see effective outcome, then you don't really need the HCG desensitizer in the injection form. And furthermore, for those who receive the injections, those on the severe end, then you do not need to receive any IV drips, IV fluids. This is a principle that we follow, but really it depends on your individual case. For patients who have pre-existing conditions, complications, severe ones as well, for example, dehydration, severe dehydration, malnourishment, electrolyte imbalance, these types of patients, they need the IV fluid, the IV drips to actually support because they are in a critical condition, and then we need to complement them with the injections as well. But for those who don't have complications, don't have pre-existing conditions, only the vomiting, the nausea, the insomnia, injections. But those who can take oral medication and see effective recovery, then you don't need any of the two. But you can see how complex it is, so we do need to assess your situation on a case-to-case basis. That's why you need to get in touch with us, and then only we can give you confirmation. Directly at Antai Hospital, if you come, we can give you the full support that you need. So that's basically the two categories that we offer. For the oral medication, benefits include it being much cheaper than the injection, and also it's very easy to use, convenient, painless. However, the injection is definitely much more costly compared to the oral form, and also it's painless, may not be that convenient because you may need a few injections depending on your severity. So these are some options that you can consider. And this treatment is effective regardless of which type you take, because its mechanism works by blocking the receptors. Once this blocking is achieved, you can see rapid recovery within days. So first response is that once you receive the treatment, you will go into a deep sleep for up to 18 to 20 hours. And upon waking up, then you will see that your appetite is regained. You can drink a lot of water, and you can consume all the foods to see that you will recover fully. Your complexion starts to get better, your weight starts to gain, you feel better now. And this is where you are on the journey of full recovery. And then we will support you with oral medication that you can bring home as well. This time, you are allowed to discharge, and then you can enjoy the remainder of your pregnancy at home, at the comfort of your home, with the support of your family, without hyperemesis gravidarum affecting it further, causing potential miscarriage, unwanted pregnancy losses. Now, do get in touch with us via the website. Antai Hospital offers this hyperemesis treatment via a contractual agreement with the patient. If you do miscarry again, or if you do not see any effective recovery, we are obligated to return you the full treatment cost, because the treatment is in fact very successful, and you do need to consider giving it a shot. Get in touch with us, with our doctors, consultations via the website. Let's talk about how we can get this treatment to you, or if you're coming to Antai Hospital directly. Leave me a comment down below and stay tuned to the next one.